Hi, my name is Dr. David Noel, and I'm here to show you a technique that absolutely will handle tooth decay and gum disease for you for your entire life. Now, most people learn how to brush and floss their teeth with something like this. And life is not like this. This is not it. You can't understand how to do it this way. But here's a face, and here's a toothbrush. Here's some toothpaste nearby where if you put a fluoridated toothpaste on your brush just like this, you can see how much is there relative to my face here. And that's the amount of toothpaste that you'll be using. I'm not going to use it right now because it'll cause foam and you won't be able to see where we are. You start in the upper right side of your mouth. You get all the way back behind your back teeth. Then, using an up and down motion, up and down is important, all the way around the front, all the way around the next side, and all the way around the back. You can go horizontal if you need to. Then down, behind the back tooth. Then you're brushing your teeth up and down all across these teeth. Remember, you're going to have some foam at times and you'll have to spit out. We're not doing that now because that would be too much for this video. Now we're going across the other side. We had to switch the direction, remember, all the way behind, okay? Now you can rest or spit or what have you. Then you go to the inside. I won't be speaking now. As you saw, I went all the way around the inside, brushing up and down, but the angle had to be different because it was the inside. Now on the upper, I'm going to the back. We're on the far turn now. All the way around to the back, like that. Now I'm going to do the biting surfaces. Now I'm going to go inside the cheek. Now I'm going to do the upper palate. And now wrapping it up, the tongue. Now, of course, you'll have toothpaste around there. And also you want to be careful not to go too far back on the tongue according to your comfort zone. Breathe deep, get back as far as comfortable. Spit out. Then we go to a nice long piece of floss. And we take that piece of floss, in my case, because I have a tooth that was broken out by a physician when they took my tonsils out, and there's a fake tooth. So I can't go through the contact areas. So for those of you who can't, here's a demonstration. I put this right through and out. See how that's in there like a little saw? But we don't saw ever. We just take the floss. We get down, like we would all the other teeth, and we get down to the base of what we call the sulcus, the bottom part of the tooth, where it's attached to the gum. And that's difficult, and it takes a lot of practice, but most of you don't have those kinds of artificial teeth that have connections. Most of you have normal teeth. You'll start in your upper right-hand side, get behind the back tooth, then slide it in. Slide it into the next one. Changing the direction each time. And you're going through tooth by tooth all the way across. Behind the back tooth, you have to loop it behind a little bit and then bring it down. If you're polishing shoes, you'd want to get it behind the back of the shoe. Here I go on the bottom. One tooth at a time, each side of that tooth. Remember, I had that one fake one, so I wrapped it around the last one. My teeth have been flossed. Thank you for hanging in there with me, and I thank my teeth for hanging in there because I brush them and I floss them with a fluoridated toothpaste out before eating breakfast, and then I rinse all out, and then I have my meal. I can rinse during the day just to keep things flowing. And then at the end of the day, after dinner, brush and floss and clean them up and rinse them out really good. And rinse your mouth as much as you want, drink as much water as you want, and you will never have tooth decay or gum disease. But be sure to get them checked just in case you're missing. But I'm cheering you on, and the people who are associated with this video, it'll come in a moment, are there to help you anytime. Here's to good oral health for everyone on planet Earth. No more tooth decay on planet Earth. No more gum disease on planet Earth. Thank you for listening and watching. Bye-bye.